I think CMO's role in digital innovation is to ensure that the technology supports clinical workflows and supplements those, and without disrupting them. I think, really my focus has been on practical digital solutions that clinicians can trust and actually use, that are actually very practical, that can actually make real-time identification of high-risk patients, optimization of workflows in the electronic medical record to decrease redundancies in care, as well as documentation. But I think the technology that's coming down the pike is very, very exciting, and I'm very excited to be involved in it as well. As I really see it as it can be an effective tool in reducing healthcare burnout in physicians, what I think is very, very prevalent these days, just because some of the overwhelming administrative burden that are being placed on physicians. So I'm very, very hopeful that some of the digital innovation solutions that are coming down the pike are going to really deliver real value by increasing clinical efficiency, reducing variation, and really supporting better patient outcomes and physician satisfaction.
And go into more detail about how digital innovation can support clinical workflows.
I think, we're seeing a lot of exciting potential come out with artificial intelligence. I think one of the most recent thing that's coming out is what's called ambient listening, which is really allows the physician to become unglued from the computer and actually be more engaged with the patient, and make that connection that's not sometimes just nonverbal, that they can actually focus on the patient and really spend time thinking and engaging with the patient. So I think the ambient listening really has the ability has really come a long way from capturing the important elements of the physician-patient encounter and putting that into a very, very reliable note that oftentimes physicians have to do either on the fly or after the fact, when they may have forgotten some of the subtleties of the patient encounter. And I think we're even seeing more sophisticated functionality in the ambient AI, where it's actually able to pick up on very, very subtle cues and simplify steps that would actually take multiple steps and is prone to error. And one of the things is with medications, being able to just pick up from a conversation that a physician is going to be changing a medication, taking the information of the preferred pharmacy that's in the patient's medical record, and actually electronically sending that updated prescription to the patient's pharmacy of choice before the visit's even over, which I think is really amazing.